welcome to Breakfast with the Mayors. I'm Mindy Tate, and this is Alina Bell, our board chair. It's kind of interesting to be here and streaming this outside the Zoom box, right? A little bit different.
It is, Mindy.
It's a little bit different for us. We're apart, but we're also wearing our mask as we stream this event to you, our live event for Breakfast with the Mayors. This is our first time to use streaming technology, so fingers crossed, toes and legs, everything crossed that this goes well. Feel free, if you're watching this on Facebook or some other social media, to share it to your social media. We would be happy for you to do that. But Breakfast with the Mayors is held quarterly, and it might be Breakfast with the Mayor as it stands right now, right, Alina? We're missing one.
Rogers is on his way, I'm sure.
we are sure that County Mayor Rogers Anderson is on his way, but we are so proud to be able to use the facilities here at Rolling Hills Community Church. It looks a little different up here this morning looking out there, doesn't it?
There's no one here.
There's no one here.
But Mindy, I'd love to say thank you to the sponsors that are behind us, particularly Pinnacle Financial Partners. We could not do our events with such excellence without the support of our community.
We are so lucky, and we really appreciate also the support of Williamson Medical Center, and we'll be hearing from Dr. Andy Russell with Williamson Medical Center in a little bit to give us an update on the current COVID situation.
We will.
It would seem like this is not a very busy time, but I know for a busy mom and busy volunteer, it is a busy time, but also as our board chair, we're busy working with the City of Franklin on a great fun project.
We've been doing scenario planning, and now we have the All-American Cities that you're going to probably share a little bit about. I'm so excited for Franklin to be represented amongst 20 other cities, and in hopes that we will be one of the All-American Cities for 2020.
That's right. We're one of 20 cities, and in a joint application between the City of Franklin and Franklin Tomorrow, we were selected to compete for All-America City, which has been going on for over 70 years. We really would love to see this happen because it's Franklin Tomorrow's 20th anniversary as well.
It is.
And no Tennessee city has been selected as an All-America City since 1999. So that would be a great honor for us. But we want to encourage people. We've got a couple contests. Our presentation and the actual contests are August 19th, and people will be able to join us and view that competition on August 19th. But prior to that, we would like to encourage them to be part of a social media campaign and tell us why they're a proud Franklinite. Mm-hmm. You can see on the bottom of the screen, we've got a frame that you can download from our social media and add to your cover photo, but then tag Franklinite, hashtag Franklinite and hashtag AAC 2020, and tell us why you're a proud Franklinite. So we're excited to see that happen on our social media channels and encourage people to get involved and help Franklin become recognized as an All-America City, because we know it's a great place to live.
We certainly have an All-American City for sure.
That's so great.
And I also wanted to just say thank you to all of you who have participated in supporting us because this is our birthday, our 20th anniversary.
We're missing being able to celebrate that a little more fully like we had planned, but we appreciate the support we have received, and we will continue to celebrate this year and next year, because 2001 was a big year in Franklin Tomorrow's history as well. So thanks so much, and we're going to get started because we have a lot of speakers to have for this program.
Thank you, guys.
Thanks, Alina.
Okay.
Great. So this morning I want to invite up next Jason Golden, who's the Williams County School Superintendent. Come on up, Jason. And I think it's on most everybody's mind, whether you have children or don't have children, what's going on with the opening of schools. And so just feel free to take 5-8 minutes and tell us what's going on with schools, and I'll be right back, okay?
Thank you, Mindy. Thank you so much for asking me to come. You know, as everyone knows, I think in the community and really across the nation, school reopening has been a really big issue. So we've been working over the course of the summer, and really even starting back to the spring with trying to figure out what works best locally. Mindy was good enough to give me a number of questions that you've asked, And I know that if we went through all the details of what we were presenting, what we've worked on over time, it would be hours and hours. Our most recent board meeting was actually a 6.5-hour board meeting as we went through our reopening plan. There's so much detail. So what I want to let everyone know is the basic framework of where we are as school is ready to start in just a little under 2 weeks, and then do my best to answer some of the questions that those of you who are viewing and knew you were going to be watching today have asked. So number one, we recognize that the presence of the virus in the community is having an impact on us. So when we structured our plan, we had a lot of conversations with local health authorities, with our emergency management folks, with the health department, and others in the community about what's an appropriate level for us to be able to open so that the services we need for our school community and the services our community as a whole needs can be met even with the presence of the virus before there's an immunization for it. So the protocol we set up was what we described as a low, medium, and high protocol. And as we refined our plan over the course of the summer in multiple conversations with health professionals, what we recognized was that those metrics that many of us in the community have heard about are trigger points for us to have deep conversations with our local providers to determine what's best for school reopening. And as we did that, just this past week, finalizing that, to let folks know where we were starting, we ultimately determined that the appropriate level for us to start school on August 7th is our medium protocol. Now, one key to that is we are starting on time. We are starting on August 7th. There are a number of communities, even in Metro Nashville, where there's been a lot of discussion about when to start. We determined that the best thing for us to do is start August 7th, because the truth is we don't know what's going to happen over the course of this year. So we're starting on our regular day at our medium protocol. What our medium protocol means is that grades pre-K, early childhood, kindergarten, first and second grade will start in our building. Now, a key reason we did that was when the health department provided the recommendations for school opening, there were 2 items that we knew were a practical impossibility for us if we were to have all students on campus. And that was social distancing on the school buses and the social distancing recommendations in our classrooms. If you think about a classroom, you have 20, 25, sometimes as many as 30 students in some high school classes together in one room, and social distancing is a practical impossibility. So with our medium spread protocol, our youngest grades can go in the buildings and spread out. When our educators talked about this over the course of the summer, it became critically important for us to make sure we found a way to promote early literacy, making sure that those youngest students were able to learn how to read with their phonics programs on campus. So that medium protocol ensures that. Also, many of our students with disabilities, our special education students, even small groups from time to time at the older grades, will be able to go into the buildings as long as they are socially distanced. Now, the commitment we made is for at least the first 2 weeks, we will be at this level. So it was important to us to make sure that there's some element of predictability, even in this unpredictable pandemic, for parents to plan. That's why we made this announcement last week. That's why we let everybody know that we're looking at a minimum 2 weeks. We are continuing to have those conversations with the health department so that if the capacity of our community to address this virus is met, then we'll be able to hopefully get everyone back onto campus this fall. Again, you've seen some examples from other communities where they might have extended this and said they're going longer. But that's our commitment right now, minimum 2 weeks. And I know that was one of the questions that was asked. So another commitment we made this year, and I think a lot of school systems across the nation have recognized this is the appropriate time to expand our online program. We have had a high school program for 2 years. We're starting our 3rd year at the high school, but we have expanded that online program for all grades K through 12. So that is an option for folks. We had about 20% of our community ask questions about that. The deadline for committing to that was Sunday, just a couple of days ago. Our staff is finalizing the numbers for that. It's obviously less than 20% who have chosen that, but those folks will be committed to a full online program for the entire semester. Everyone else in the hopefully will be at some point during this semester in the building. One commitment we really ask everyone for is do what the mayors recommend to try to minimize the impact of this virus so that our students can be back on campus as quickly as possible. So a big question that was asked was, how do we ensure that students don't fall behind, and how do we measure that? We have a number of what we call formative tests to make sure that we track student progress. We have spent some time with our teachers. We have a pretty detailed program that we call Remote Learning 101 that our teachers have been working on so that our teachers can be able to communicate and teach our students even when they're in a remote environment. We're very excited about that. We have platforms for our teachers and our students to communicate. Schoology, Google Classroom. Many of your children are familiar with those terms already, and you're going to become familiar with those terms over the course of these next few weeks. So we know that over time, things are going to look different in education because of the ramp up in the use of technology. We have a commitment from the County Commission and our school board that every student will have a Chromebook assigned to them. Many principals have already sent that notice out to families telling them the schedule for picking up those Chromebooks. Everyone will have that schedule by the end of this week as we're speaking today, so students can come pick up their Chromebook and learn how to communicate even better than they have been up to this point with their parents. And so from a connectivity standpoint, we're very excited that we were able to survey our parents about internet connectivity. About 2 to 3% of our families said they did not have internet connectivity at home. About 9% says it's intermittent. And so we have a tiered program for folks if you don't have internet connectivity, and I know many have already taken advantage of this. Contact your school. We have a product that you can get. We call it, it's a Kajit, that's actually the brand name, so that you can have a Wi-Fi hotspot off the cell phone towers in the community. And then if that won't work, we have a third tier system for you to use as well. So make sure that you have that internet connectivity at home. Had a big question. How are the special needs children and children who may not have that internet connectivity get their education? We've talked about internet connectivity. For students with special needs, each individual will have a detailed conversation with their teachers to make sure we meet your needs. Some of it will be remote with your classmates. There are some particular services that we provide that you really need to be physically present. And so it's important for you to have that conversation with your schools as well. Had another question, will there be any rezoning changes this year? The answer is no. We're not rezoning. We've had enough changes right now, and we're going to make sure that we keep our zones the same. I know many that you're here. I certainly don't want to consume too much time, and so I'm gonna turn the floor over to you.
Jason, you and your team have done a great job of trying to communicate using social media and live stream and that sort of thing. So will you be doing more of those in the next week or so, or how parents will be getting information?
That's a great question. So on our website, on our COVID-19 website, the large banner at the beginning, we have a number of communications that we've had, Facebook Live events that we've recorded. We're going to continue to do that. Questions continue to come in from parents, and we continue to refine our answers and make sure that we do what we can to communicate with parents about that. What we talk about is kind of a 2-week, 2-day program. We're committed to 2 weeks at a time if we have to go remote for some of our students. When we're able to get back in the buildings, there's a potential that if a positive test occurs, we may have to close a building for 2 days.
So if a parent has a question, is the best thing to do to contact your school or to reach out to the central office?
So number one, with schools getting ready to start, the best answer is contact your schools directly. This is the time to talk with principals about exactly what they're doing in the buildings. Now, once school starts, a student's teacher is going to be the number one, because we are starting school. Not everyone's going to be on campus on day one, but we are starting school. So teachers are number one when school starts.
Great. Thank you so much for being here this morning.
Sure.
And if you have questions, people can reach out to you or to their school. But thank you so much for being here.
All right.
this
Thank you,
morning.
Mindy.
Have a great day. Well, it is Breakfast with the Mayors, so I'm going to bring those guys up. And we're practicing social distancing here. And so we'll bring them on up. Franklin Mayor Dr. Ken Moore and Williamson County Mayor Rogers Anderson. So y'all take a seat and we'll start. But Rogers, you've got a mic in your chair. We don't, just we'll take these, we'll relax this a bit, but we've got them if we were close together. We have on the phone, you asked us, Rogers, to have someone from Williamson Medical Center be part of this conversation. And we'll start with you. And we have Dr. Andy Russell, I think, on our Zoom call. But tell us a little bit about how Williamson County is responding to this COVID crisis and the role that Williamson Medical Center plays. And we'll get Dr. Russell up on the Zoom.
Well, thank you, Mindy, for the invitation. Thanks to everyone watching, taking time out this morning to have breakfast with the mayors through the Franklin tomorrow. Overall, I think you can look at the numbers over the last 6 or 8 days and see that the numbers, to the degree we're looking at, are flattening out a little bit. We also want to say thanks to all of the business out there that have worked to keep this mask mandate in place. It's not always easy. It's not a popular decision. It wasn't a popular vote. We looked at a lot of things, a lot of those items we looked at in making that determination. I say we, all of the city mayors across the county discussed this one complete weekend, looking at data, looking at the information we had, looking at healthcare, or listening to healthcare people that deal in that, and we're working around that. And so thanks to everyone. I've noticed personally myself when I go out and travel around that more and more people are wearing masks, trying to help keep this virus from exploding any more than it is. And although there's a lot of data out there that indicate you're really not going to find a cure until there's a vaccine or some kind of treatment, and they're working diligently on that. One of the people we dealt with, I hope Dr. Russell is
right there.
up there now.
He's right there.
Oh, good morning, Dr. Russell. So I would like to call on him to kind of have a conversation with us from the eyes of Williamson Medical Center and the number of COVID beds and things like that. And I know Dr. Russell will get into that. Thank you.
Thanks, Dr. Russell, for being here this morning, and we appreciate that you're here. We've got about 5 minutes to talk a little bit about what's going on at Williamson Medical Center and how the response is, how that's changed, and what people need to know. So update us on Williamson Medical Center and how that's going.
Sure. Well, first of all, Mayor Moore, Mayor Anderson, I just want to say thanks for having me here this morning. And I will take just a couple of minutes to provide an update on the COVID situation here in Franklin and the greater Williamson County area. As of yesterday afternoon, Williamson County had a total of 2,943 COVID cases. This began back in early March, with the first one being diagnosed on March the 5th. So out of those 2,900, there are only about 1,400 that are active cases right now. That means that are currently having symptoms, receiving treatment and that sort of stuff. So 1,400 active cases, and unfortunately there have been 21 deaths in Williamson County from COVID. Just to help put those numbers in perspective a little bit, across the state there are almost 97,000 cases. There have been right at 978 deaths, I believe it was, the last count I saw yesterday. Murray County has about 900 cases. Rutherford's about 5,000 total cases. Knox County's a little over 3,000. And then Davidson and Shelby counties are where the biggest problems are, both with between 18 and 19,000 cases there. So 2,900 is a lot, but again, it's not as bad as what some of the other cities and counties in the state are experiencing. So as I mentioned, our first case was diagnosed on March the 5th. For the next 4 to 6 weeks, we had a pretty sharp rise in the number of cases. When Governor Lee issued his safer at home order, the number of COVID cases dropped drastically, and we had a 4 to 6 week period where there were very few, if any, cases in the area. However, once we started reopening the economy and more people were out and about moving around, those numbers have climbed steadily again. From the middle of June up to the middle of this month, our numbers have really spiked, but thankfully, Mayor Anderson, your county mask mandate a couple of weeks ago has helped. And we are finally beginning to see signs that the rate of new cases is starting to slow down, as you mentioned.
Right.
So what are some of the things that we've done at the hospital to help during this situation? Immediately the morning the first case hit, we convened what we were calling a COVID task force that we put together to help guide the hospital and the community through these times. We immediately began working to find more hospital space, more beds for the COVID population, as well as trying to stockpile PPE to keep our staff safe. There are several areas in the hospital that we've repurposed so that we can use those for additional patient rooms. We've created 32 negative pressure rooms in the hospital, and that's just an isolation technique that we use that minimizes the airflow between rooms to hopefully prevent virus moving from room to room as well. We've also put surge plans in place, so we've not reached full capacity at this point, but luckily we have another 30 to 50% capacity we can add if needed. That would just entail repurposing some other space and curtailing other services, which we don't want to do unless we have to. So we're leaving those areas in their normal state until we see that we absolutely need them. We're in touch daily, almost daily at least, with various state leaders and other hospitals across the region and state, just so we can keep abreast of the latest news and happenings, see if there are any new treatment options, and just to bounce ideas off of them to make sure that we're managing all these problems as best as we possibly can. We've also increased our use of telemedicine services to help continue to care for our patients, because there are other illnesses out there besides COVID. Heart attacks and strokes and diabetes and things don't stop just because we're in the middle of a pandemic. We have to continue to care for all our patients, and telemedicine has helped us do this as well.
Thank you so much. And we know that you all are working closely with other county officials to respond to this, such as the testing that's going on at the Ag Expo Center. So what's your best advice for people over the next few weeks as we get ready for school to return? And Dr. Russell, what's your best advice for people as we get ready for August and the next steps of reopening the economy?
Well, primarily we need to really continue to be vigilant about wearing our masks. Make sure you're washing your hands, continue to socially distance as much as possible. And by doing these things, that's going to be the best way to get our kids in school, keep our economy running, keeping the businesses open. My concern is keeping our staff healthy. We've had more and more of our hospital staff that are getting ill, or their family members are getting ill, and that's what's making us feel more pressure now, is that we have rooms to care for the patients, but we have to make sure we have the staff healthy enough to care for their patients as well. So just continue to do the things that Mayor Anderson mentioned between the masks and hand washing, and continue to distance. Those are the main things.
Thank you so much. You look like Wall-E the robot here today because you're on a stand, and so it looks like you are talking to us from isolation. So we appreciate your being with us this morning, and we appreciate all that Williamson Medical Center does for our community. Thank you.
Thanks for having me.
So Rogers, testing at the Ag Center is still going on daily. Tell us a little bit about how that's being staffed.
Early on, Kathy Montgomery, our public health director for Williamson County, her staff have worked very hard, very diligently. We tried to do the testing at the administrative complex. That was not real successful because of the way the traffic flows in and out. And immediately we called upon Kenny Wallace and his staff to get the area at the Ag Center prepared so that we could drive those cars through. They'd never have to get out of their vehicles. And with the aid of the Public Health Department, Kathy, many people within our own organization, doing a lot of the paperwork, and the Tennessee National Guard, we were averaging 400 to 500 a day. Over the last 2 or 3 days, maybe it's because of vacation, our numbers haven't been that high. We had a high of about 1,150, if I remember correctly. But it's just a steady flow of cars. And as everyone knows, through the governor's order or desire, that anyone can be tested. You don't have to just be from Williamson County. Public health does not stop at the county border lines. And so a lot of the people we've been testing have come from surrounding areas. However, those test results go back to the Marshalls and the Murrays and the Williamsons and the Davisons all the way around. So I think that has helped. The more you can test, your numbers are going to go up a lot, but it seems to be the direction we're getting from the CDC, the guidelines they're putting out and through the state, that helps us to see and take a snapshot of time on a day-by-day basis.
So anything else going on in county government? It's just real quiet, I bet, just nothing happening.
Well, I want to say thank you to all of the employees in the county government, because it's a different time. Elections are going on. If you come to the administrative complex, there are other sites to do your early voting. We encourage you to go out and vote. In the administrative complex, you would go in to the left. If you're getting car tags, that's never slowed down. Mrs. Anderson, her department, they're just nonstop trying to catch up and keep up.
You can renew by mail or at one of the kiosks at the county rec center.
That's it. And just last week, we put a kiosk in the administrative complex. So you still have to have your admission testing. But once you get that, you can hopefully breeze on through a little quicker. And to all the different departments that are having to work by appointment only, business does continue to have to occur. And we're just trying to keep you safe and our employees safe. And overall, I'm very proud of the way that everyone is reacting.
We'll talk about early voting towards the end of our program and remind people, but it does continue through August 1st at locations across the county for the August 6th election. But we'll talk about that in a few minutes. Mayor Moore, how's things in the city of Franklin?
Well, thanks for asking, Mindy, and good morning to everybody, and thanks for those of you looking in. It's really an honor to be up here with Mayor Anderson, but this is a totally new environment, a bunch of empty chairs. I don't see any cutouts of any of our people that normally visit.
No, Jason's not a cutout.
He's for real?
They don't make them that
okay.
tall.
Wow.
6'10" cutout is not good, Ken.
So I did have a little presentation, if I could kind of go back to the beginning of it this morning. And this is really a new and different time, and we have a lot of different challenges going on right now. And this particular virus is a new virus, and we don't really know a lot about it at this point in time. We don't know how long immunity lasts, just lots of different questions about it, but we do know 3 important things about it. And that is, if you wear a mask, if you wash your hands, and you physically distance, you're going to decrease the odds of spreading this particular virus. So Dr. Russell mentioned that, and I think that's extremely important. The next slide, this slide, back up one if you would. This slide actually gives some of the latest statistics, and for the past 7 days, we've actually seen a net decline in the active cases. This slide, this graphic, actually I don't know which one I'm looking at.
You're looking at the bottom.
The bottom?
Mm-hmm.
Okay, good. This graphic actually depicts active cases in the last 30 days. And if you look at the way that curve is going, it does seem to be flattening. But the fact is in the far left, that was 424 cases 30 days ago, and now we have 1,500 plus cases just 30 days later. So that gives you some idea of the contagiousness and the spread of this virus. And the next slide shows that the active cases in Williamson County just in those 30 days increased 356%. But the good news is we're starting to see some decline in negative numbers at this time. The next graphic is one that, and these graphics I attribute to Michael Walters Young there at City Hall. But on the far left, you'll see kind of that little small yellow blip on the graph, and that was when we thought we were having our peak. But of course, you look to the far right now, and we see that we have a lot more cases. But the good news is, again, that it continues to, the case numbers continue to decline. And I think that's strictly because we are seeing a lot of compliance in our community. We see national companies that are saying you must have a mask to come in our store. We're seeing the employees' mask, we're seeing the customers' mask, and we still see people that think it's an infringement upon their rights to ask them to wear a mask. But if you think about our healthcare workers that are exposed to this every single day and the risks that they're taking, it's a small price to pay. I guess the next slide kind of gives us an update as far as how this has really affected us financially as a city. In the last, we just got sales tax numbers for May, and we noticed that we're down $283,000 on our normal collections, or about 9.2%. Then if you look at March to May, which is the latest sales tax information available to us, we'll notice that we're almost $1.4 million down for that 3-month period of time. We have passed a budget. We've cut our budget about 10%. No layoffs, no loss of services. We are dipping into our reserves, and I think this reflects well on our practices as a city to do a lot of planning and make sure that we're financially sound. The worst thing we could do right now is throw our arms up in the air and say, we're not going to do anything else until this is over. Well, that's not the way it works. We're continuing to do a lot of projects. The next slide shows a $132 million investment that we're making in our community so we can continue to grow in an orderly fashion. This is a state-of-the-art facility, and it's moving along very smoothly. The next slide just shows another area in that. We recently opened the bids on Franklin Road, so we should be seeing some action there very soon. We were delighted that Franklin Road came in under budget, under what we had projected. This is going to be sidewalks, new infrastructure, so on and so forth, from the bridge downtown all the way out past the factory. And of course there are other projects that we're doing that continue to move along. We're not stopping doing projects, but as we move forward there may be a little different staging that we're going to be looking at. One of them that we're looking at is starting to look at a potential new city hall. And that doesn't mean that we're breaking ground next week. What this means is we're going to start doing some studies to understand better what our needs are and what the challenges are to build a new city hall. So there would be some definite stopping points along the way. So that's all I've got today, and thanks for having me.
So both of you, this is unprecedented, and I'm sure you're tired of hearing that word just like I'm tired of hearing the word pivot. But this is unprecedented, but county government and city government go on, correct? And how can people access these services that they need today? Talk about just briefly about the county and then about the city.
I'll let Ken go first on that one. He's warmed up, if you'd like.
I'm warmed up. I'm not quite sure I understand your question.
Is
What are we
City
doing?
Hall open? Is City Hall open? How do
City
people-
Hall is open, the regular hours. We still have folks that are working remotely from home, and so they may come in 1 or 2 days a week, and the rest of the time they're at home. But we're offering all the services now at City Hall that you're accustomed to using.
And likewise on the county's part where they can work at home and be efficient. But as you know, Mindy and all of the people out there, new home permits are about what they were last year at this time. They've slowed down a little in March and April, but they, for the most part, coming in the same as they did last year and the year before, and we're seeing a lot of activity up in Sherry Anderson's office with the low interest rates, refinancing, and so all of our departments, from the property assessor, the trustees, getting, as you know, we didn't have a property tax increase this year, so they're getting the billings prepared to go out. Property assessors doing reappraisal. I mean, everything is still going on top of everything else we're doing. It's just a little different mechanism in which to get into our offices, and for the most part, I think that is flowing very good. And I want to say one other thing before I move on. We're very fortunate to have Dr. Moore, Ken, as the mayor during this pandemic. He's the only physician out of all of the mayors, and we have, Nolensville, Thompson State, they're all good men and women that serve in that capacity. But I think a lot of us do really rely on Ken and his expertise in the medical field. He's not only a personal friend, but during this time, particularly in those early days, I relied on him a great deal for the decisions we needed to make, because he thinks through physician's eyes as opposed to just a politician's eyes.
Great. Well,
Thank you.
Government trickles down from the federal level to the state level to the county to the cities, and we're going to bring on our keynote speaker who's going to join us by Zoom, and that is Commissioner Mark Ezell from the Tennessee Department of Tourist Development. And both of you have been working with him as part of the governor's economic recovery group and in response to the crisis that occurs here. But Commissioner Ezell is part of Governor Bill Lee's administration, and as Commissioner of Tennessee Tourist Development, he's responsible for growth strategy and overall branding of the state's global tourism footprint. And tourism is a big business in Tennessee. It's a big business in Williamson County as well, and we know that. It is the #2 industry in the state of Tennessee, and it continues to see significant growth under Commissioner Ezell's leadership. Was and is, let's hope, the fastest growing sector of employment in Tennessee, with over 340,000 jobs and ranking #1 in the nation in hotel pipeline growth. Tourism generates over $1.8 billion in state and local tax revenue annually. So prior to joining Tourist Development, Mark Ezell worked his way from entry level to eventually serve in a range of senior roles at both his family-owned business, Purity Dairies Incorporated, who got milk delivered by Purity Dairies to home, for sure, in Middle Tennessee, as well as Dean Foods, which is a Fortune 500 company where he focused on brand development and achieved record profitability. He received national recognition for his work on campaigns including the iconic Milk Mustache Got Milk campaign. I've known Commissioner Ezell for a long time. We went to school together at David Lipscomb Elementary, Junior High, and High School, and he went on to college there where he received his bachelor's degree and completed his master's degree at Tennessee Tech. And he's a 7th generation Tennessean, and he and his wife Martha have 4 children and 5 grandchildren. And we are waiting for him to come on the Zoom call. So tourism in Williamson County, we've got Lauren Ward with us as well, who can answer local tourism questions. But Rogers and Ken, tourism is a big business in Williamson County.
Absolutely, it is. When you look at the volume of revenue that comes in from the tourism dollars, it's a little over $500 a year in the property tax rate for individuals. So at whatever you're paying in your annual property tax, it could be $400 to $500 more without people coming to our town and spending money. And you know, I know during this COVID period, the numbers have changed a great deal, and the Convention Visitors Bureau, under the direction of Ellie Chin, I know it's taken a hit on the chin, but I'm confident as we move on down the road, we'll find other ways to draw back in those tourism dollars.
Great. We've got Commissioner Ezell on with the Zoom call now. We said this before, we had another guest from Williamson Medical Center by Zoom. It kind of looked like Wall-E the robot on a little stand because you're on that TV, but our guests can see you for sure. Welcome this morning.
Thanks, Mindy, and sorry I could hear you, and it's certainly a pleasure for me to be here. Sorry I can't be here with you. I can't be there with you in person. The governor has we do meetings literally 7 days a week now, the last 12 weeks, and we're scheduled in just a few minutes after I finish to be with him and to discuss items like Mayor Moore and Mayor Anderson are talking about. Let me also say thank you to those two gentlemen. What great public servants. I think I served Rogers Anderson about 30-something years ago on home delivery after graduate school. He was on my route. So really have a huge respect for those two gentlemen, actually for their courage with doing the mask requirement earlier than some others. And we'll talk some more in a little while about masks, but it's good to be with you. And I've lived in close to that, right on the line of Williamson County, but certainly view that as a homeland of ours. And I'm honored to be here.
Well, we're glad to have you here, and normally this auditorium would be full of, and we had over 350 people registered to participate in this streaming technology event, but you're a businessman. Your background is business, and tourism is a big business in Tennessee. So let's talk a little bit about tourism and about the response for COVID that's going forward here.
Absolutely, and I do want to say thank you to all the businesses throughout Williamson County that have worked so hard to survive during this time, and even to and I saw the budget numbers, and you can see what kind of battle back that has happened in Williamson County by seeing those numbers start to head back, and we'll discuss that on a statewide level, but. The next slide will take you through to what a great job Williamson County has done in tourism, and what an honor it's been for me to work with Ellie Chin and her team. These numbers of the 2018 will actually release 2019 later this month with the governor on economic impact. But you can see a 6% increase in 2018. Williamson County again in 2019 set another record, bringing in $38 million in 2018 and even more in 2019. We were turning the corner, and you can see on the next slide, we really were looking for significant increases in the Middle Tennessee area, and Williamson County is known for their music artists that live there. We had just finished the amazing Ken Burns, where over 40 million people had watched that show that highlighted so many places in Tennessee, but especially in Middle Tennessee. And Ellie and her team were ready to take advantage of that. They had a record pilgrimage last year. We're on target this year. And then you can see the next slide that all of us have had to endure when COVID hit. And as Dr. Russell has talked about, and then Dr. Moore, when COVID hit, you can see this particular chart. And if you would like to have an ability to keep up with the economic recovery that states are doing, you can go to a program. It's called tracktherecovery.org. It's put on by Harvard University in conjunction with the various MasterCard and Visa that provide spending habits from all states. And this is a chart that shows on April 12th. It's actually the day before the stimulus checks got out. You can see here in the top, if you can see it, hopefully, in the top right, you can see that Tennessee's economy was down by 25% in spending. The national average was down at 32%. And if you'll go to the next slide, you can see the devastation that was being created at the same time that the health crisis was going on. And once the stay-at-home order and the methods to fight COVID-19 were put in place, then the second war started, and you can see over almost 750,000 unemployment claims. Our unemployment claims in a couple of weeks went from roughly 30 or 40,000 people to a couple of 100,000 people that had lost their jobs. 23% of the Tennessee workforce, our unemployment hit almost 16%. It's now down to a little under 10% for June, and $5 billion projected GDP loss to our economy. And if you follow the next slide, you can see that jobs were dramatically impacted. And if you'll look at the third line, you can see that it's in that area of tourism, hospitality, and leisure. And so I had to see firsthand, up close, the devastation in loss of jobs and people asking how they can get their livelihoods back as businesses were forced to close down and to have to stay at home as we tried to have a remedy in fighting COVID-19. You can see here that clearly the hospitality and leisure, here was 125,000 still on the unemployment jobs as of July the 11th. And the top category, the music industry, was also dramatically affected by that. And the next slide shows you that in revenue, and you heard Mayor Moore talk some about budget items. Well, this is the state budget, and these are May tax collections, which reflect April. And take a look, and you can see the top chart shows that eating and drinking places were down 33 million, hotels down another 22 million, amusement services down another 5 million. So over 60 million of our $100 million losses were coming out of that, what we call the tip of the spear, that hospitality and services area. And as you know, it's important for our local groups and our state groups to get tax revenue. It's how we pay for schools and emergency services and other healthcare items. And so Governor Lee asked me to come on board and to please come and help lead the efforts, the Economic Recovery Group, and the efforts about that second war that were going on, and that's the devastation that was happening economically. So we came on board right around the middle of April, very quickly brought together a group of trade associations that represented over 125,000 jobs in Tennessee, 300 working industry people. And on the next slide, you'll see we created the Tennessee Pledge. How do we reopen Tennessee responsibly? How do we still do things that allow jobs to be provided, livelihoods to be restored, but try to do that in as safe a way possible? And so we created the Tennessee Pledge. In Williamson County, what we see is there's a whole lot of businesses trying to do things well. We have a lot of businesses that are following the Tennessee Pledge and the main tenets of that, about washing hands and extra sanitation, about temperature screens and checks for their employees, about social distancing, and about their employees at the time wearing masks. And so I want to say thank you to those groups who have been working very hard. And I know how both of these mayors and the Chamber of Commerce, Tourism, and so many others have worked together to try to get folks to realize that we have two battlefronts, and for us to be safe in our efforts against COVID-19 and to get the economy going, we've got to pay attention and to do things the right way. So thank you for those, and for those who are not, our message is we hope you can help us follow the Tennessee Pledge. If you'll go to the next slide, you can see tnpledge.com is how you can check out what you need to do to participate in our program. And we hope that it's very easy. We have guidelines for almost 20 industries now to see and and to follow a playbook that allows you to try to do things in a safe way. One of the things we've been doing along with the Tennessee Pledge is we partnered with the Baker Center and have got a very robust qualitative study of 1,200 Tennesseans. We've done now 3 waves of it. Here's some of the results that just wanted to share with you, because sometimes it's hard to decide what people really think. And I know, mayors, I know the calls that you've gotten about mask requirements. I know the emails and letters that I've gotten on mask requirements. But 68% say that they are trying to wear masks and to cover themselves when they're in public. 80% are trying to do social distancing, and 82% are trying to wash hands. The next slide, and again, this is 1,200. You'll see a lot of surveys. You'll see 400 respondents speaking for the state of Tennessee. This is a 45-question survey that's done every 3 weeks that tell us that a lot of people really do want to try to do the right thing. More than 2/3 of the folks want to try to keep the economy open, and that's what the Tennessee Pledge is all about. How do we keep the economy open? And on the next side, we believe that there's about 3/4 of the people that support the Tennessee Pledge, 77% on the next slide, that say we really want to see the economy open, and we do believe that COVID-19 is real. So let me give you a quick update on the recovery. Again, we go back to the tracktherecovery.org, and we take a look at our June 10th. And what you can see is, because of the work of Williamson County folks and so many people around the state, Tennessee, with people following the Tennessee guidelines and the Tennessee Pledge, Tennessee during the month of June was either the leading or the second or third leading state in the United States in economic recovery. This particular date's on June the 10th, where Tennessee, you can see from January spending, had actually come back and had bounced back to exceed January spending with 4%, whereas the nation was still at an 11% decline. So again, thank you for the work that's been done. And what we saw during the end of May and the first 15 or 18 days of June is Tennessee had done a great job. Next slide shows that even in restaurants and hotel spending, we were only down 12% compared to the national average of 37%. Again, Tennessee was #1 all month of June in hotel spending reduction. And then on the next slide, you can see that our June, which represents our May, while we're still down, you can see again, hotels, eating are still down the most. That number's gone from 60 million to 40 million, and we are appreciative of that. But on the next slide, you'll see what happened starting pretty much in mid-June, and that is COVID strikes back. And so I want to take the last 5 or 6 minutes to talk about masks. Let me start off with saying how much I appreciate Mayor Anderson with his mask requirement that is helping lead the way. I'm going to mention 3 things really quickly. Number 1, just want to point out that we've got a bunch of folks who have tried to join what I call the honey side or the sweet side of the stick, and that is in joining our Tennessee Strong Mask movement. If you've got a business that has a consumer, this was a plan we put together about 5 or 6 weeks, really wondering if we had missed the window on when masks would be relevant. But we put together, being a brander, and let me say thank you to all the purity lovers out there, because I deeply appreciate all that you did for our family and for that company. But what we know of brands are people want to wear brands. So Joe and Sally might not want to wear a mask, but if they can wear a brand of their university, as you'll see, or the Titans or their communities, then they'll be, especially if we can make that mask available for $3 or $4. And so I just want to say thank you as we flip through these next 2 slides. We were hoping to get 10 companies or 10 communities to give 10,000 masks each. Well, now we are at 70 companies and almost 700,000 branded masks that are out there, where Joe has that hat or he has that t-shirt, and maybe Joe will be more likely to wear that mask. And I want to encourage you, you can see on that second side, you see Franklin. promoting the community with that Franklin, Tennessee mask, and people can show their pride. Next slide just reiterates that 70, and we think we're going to get to almost 1 million branded masks affordably provided. And then next, let me just kind of say that the mask wearing is changing, and we're so grateful. Mayor Anderson, along with all of his mayors, made a decision a little earlier than some of the others, and we are deeply appreciative of that courage. And now what we're seeing is, on the next slide, you can see the number of companies who are now requiring masks. So if Joe was against a mask 10 days ago, well, guess what? Joe can't get in, not just the Starbucks, but now he can't get in Walmart, or he can't get in Kroger or Publix or Best Buy or Home Depot without a mask. What we're seeing is, and even last week on Friday, Dollar General, Tractor Supply have now put signs at the front saying masks are required. McDonald's has got one that starts on August 1st. We hope that the adoption by our businesses saying, we want you to wear a mask, can help people make that a regular part, because the CDC has been very clear. And in fact, take a look at the next slide. What would the leaders of the economy say is the most important thing for the economy? Would they say it's our interest rate? Would they say wearing masks, they believe, is the number one thing right now that is essential for their economy? Why? Because if we can't stem the tide of COVID-19, we've seen what's been done in Nashville and in Memphis. We also have seen what's been done in states that never thought they would go backwards, in Florida and in Texas. And that's why we are begging people. That's why I'm begging people, please put on a mask, because we want to keep the economy open. And then last week, on the next slide, you can see even our president has helped in making the transition to wearing a mask and to making sure that our people know that it's patriotic to wear a mask. And we're trying to give permission to folks to wear a mask and to help us in the mask mandate and the mask requirements. Next slide. This is the White House map. And this was not updated as of late last night. The White House has just released. Dr. Birx actually was in the governor's meeting that I was in yesterday, talking to us about the steps that the White House feels like need to be taken. And again, we have 22 counties who have put in mask requirements. The governor believes that it has to be at a local level that masks are put in, because local is where most people trust. You've known Mayor Moore, you've known Mayor Anderson, and he's trying to be completely supportive. And you'll see in just a second that we have on the next slide, we have almost 2/3 of our folks now are under mask requirements, and we are grateful for that. We believe it's an important step. And like what you heard about Williamson County, we're seeing a trend line that is flattening for those groups that are wearing masks, and we are trying to get more masks every day to be required. And then lastly, I'll close with that in support of that, we just implemented, as you go to the next slide, you'll see our Face It Mask Fight COVID-19. We're going to be spending $2 million to help people realize that all the retailers are requiring it for you to get in. It's politically stopped. It's hopefully stopped becoming an issue, and we are now being able to rally around what we see health experts now saying, the more we study the disease, we know that masks can help. And that statewide campaign on the next slide has launched. And then I'll close with this last slide. Why do we want to do masks? Here's why we want to. If you'll look at the tracker on the last slide here, you can see how spending has declined in these last 2 weeks. 2 reasons. The research says if people see case counts go up, they stay indoors and they stop spending. And then second, we know that Tennessee has had to have a couple of counties who cut back. So just wanted to say that we appreciate all that's being done. The governor is about to extend his mask requirement. We believe we have a number of other counties who are about to, especially those White House red counties. And I'm so appreciative to Mayor Moore and Mayor Anderson. If I can answer some questions, I've got some time to do that. But thank you for letting me come. Thank you for helping us as we got our economy back up and going. And now we got to deal with this COVID-19 striking back, whether it's clusters that are happening at church, happening on the ball field, happening in businesses. If we can all socially distance and wear masks, we think it's a strategy that can keep our economy open. Thanks, Mindy.
Thank you. And we've got our mask here this morning. We've all got a mask ready to wear. And we appreciate your being here. Some questions. How can local business help with promoting tourism in Tennessee? How can local business help promote tourism in Tennessee?
Well, I would tell you right now, we have the pause on our tourism efforts at a state level, and we see that with most of our destination marketing organizations. And again, Ellie is on our Tennessee Tourism Committee. So what we're trying to do is promote safety. I think it's really essential that we show that a visitor, if they want to come to Tennessee right now, that we are going to require you to socially distance and to respect our residents and our workers and to wear masks and to do those. And then if we can get some of our numbers down, we can get back into more promotion of tourism. But right now, our emphasis has got to be on how to do that most safely.
Do you think we will see tourism bounce back to pre-COVID-19 levels within 12 to 18 months, or will it take longer than that?
Well, I think if you mean after a vaccine, absolutely. I had no idea. I was not a tourism expert. You know, I was a milkman for 40 years. But I identify and know what it takes to make. My granddaddy used to say, Mark, in order to have a great brand, you have to have tremendous products. Tennessee has got simply amazing assets. And we're even seeing how many people have come into our state because of our outdoor assets, our rivers, our lakes, our national parks, 56 state parks. So there is no doubt we've had to take a pause on some of the music assets, some of the group assets that we have, but absolutely, Tennessee's continuing to really crush the national average in growth on tourism. We'll be able to do that because we've got the assets when it's the right time.
Some people, I guess, don't realize that tourism is the #2 industry in Tennessee. And so one of the questions we had is, why are we pushing tourism during a pandemic? And what best practices are we implementing? But why are we promoting tourism during a pandemic situation as we're in today?
Well, I would tell you that we only really, for a few weeks, have our office in the last several months and promoted tourism. And when we did, we talked about traveling safely in Tennessee. We're actually looking at how we can utilize money for this fall. Again, it's about, if we're talking about traveling in Tennessee, especially what we've seen is Tennessee's blessed that we have so many assets. We're a great drive market, and we're seeing a lot of in-state traveling. So how do we get somebody's pent up in their house and they are stir crazy and they want to travel from one city to another in Tennessee? How do they do it safely? How do we have that business be ready with the Tennessee Pledge to accept them so that I can come in with my family and grandchildren and be able to enjoy something that I know it's clean, I know it's going to be taken care of for me to travel safely. So really, our emphasis in tourism right now is about doing so safely. And if we can't do it safely, then please don't come. Or we're asking businesses to change the ways and make sure. And we've got some establishments in Williamson County. I've been to some bars before where we went to study and see, and they're not abiding by the social distancing. That's bad for Tennesseans, and we don't want to promote that kind of behavior.
And you showed a map as part of your presentation where you could see some counties were in the red zone, some were in the yellow or gold zone. Middle Tennessee is a regional economy, but the mask mandate is not across all counties. How are we going to stop the spread if there's not a uniform policy in place?
Yeah, it's a really great question, and one we're wrestling with. And what I can tell you that in the last 2 days, I've been working very closely with a couple of neighboring counties, talking with them as they are, in fact, one of those just moved from yellow to red. And really, it's at the red zone that masks make make so obvious a sense, because actually the White House is saying you should close the in-room dining sections of those restaurants. So what we're trying to do is, we know if we force a mandate and someone's local sheriff and local police department don't have an interest in that and say, we don't have any, we are not going to regard that as something that's important to us, that we're not going to be as effective. So it is part of my charge from the governor and the Unified Command to be trying to convince those mayors to move forward. And then the governor, in fact, the governor called out Mayor Ketron last week for joining the mask requirement process. And we're trying to do that, especially as we're bringing ground coverage with this new Face It mask fight COVID-19. It's a courageous decision. It's one we're trying to get people to do. And now that the retailers are moving, we believe you're going to see more and more groups do that. The Northeast now, all 9 counties have joined around that health care facility and have implemented a mask mandate. So that's going to be our model moving forward.
Thank you so much for those comments. And this is Breakfast with the Mayors, and Mayor Anderson and Mayor Moore wanted you to be here. And so any thoughts or how it's been working with the state? I know we have the local mayors here work well together, but you also have a mayor's caucus and other things. How has this been working with the state?
You know, it's been interesting.
Well, I think the important thing to mention quickly is that regionally and locally in Williamson County, we've all been on a lot of different calls and discussing a lot of these issues and how we can work collaboratively to stop the spread of the COVID-19.
And I think under the direction of what everyone is trying to do, we're trying to hold this economy steady, build those numbers back up, as you heard Commissioner Ezell's kind of reflect on those, because at the end of the day, until they find a cure for this, find a vaccine for this, we just got to figure out a way to keep our kids in school, get businesses going again. And government can't do all of that, but we can be a conduit to help lead the way on that. And the 6 city mayors and myself, we're committed to turning Williamson County back into that vibrant community that it has been. And I was very encouraged last week when the Department of Labor came out with their figures, our unemployment numbers. Again, we led the state in the lowest unemployment numbers, but yet it's 7%, which is 2 or 3 times higher than what it was just 100 days ago. So we're all working in that area under the direction of what Commissioner Ezell Mark is doing up there. We're most appreciative for the direction that he's sending us in, and better times are on the horizon.
Is that your message too, Commissioner? Better times are on the horizon?
Absolutely. I think one of our state's leading ladies, Dolly, says it best: brighter days are ahead. And I want to say again, what courageous leadership you have by your teams, as we see, and again, I've gotten to talk to both of these mayors multiple times, and to just see the compassion they have for people, how much they want to serve them, and to help people, do the right things in a time where a lot of our state is divided on how we should be approaching things. And I just really appreciate the way they're trying to lead that way. And we need everybody's help to be as united as we can, because we really do want to keep people safe, keep death counts very, very low, and keep our economy going so that people can have livelihoods.
Well, thank you so much for being here. We promise to have you back when we have a room full of people that you can see and shake hands, because you'll have a lot of old friends in the area for sure. So thank you so much for being here with us this morning. We're going to wrap up with these mayors, but thank you for your time this morning, Commissioner Mark Ezell.
Thanks, Mindy. Good to be with y'all.
Great. So thanks so much for that. That was great, guys. So we'll wrap up with a few things. Obviously, we've mentioned before, it's Franklin Amoro's birthday, but we really want to encourage people to stay attuned over the next few weeks. As mayor, we strive to become named an All-America City. You're pretty excited about that. And we're trying to figure out what silly thing we can make you do for the presentation, but
Maybe just show up.
Just show up. That might be it. That might be it. But you can support Franklin tomorrow and help us through this process, and we'll be sending out information about that. But right now, early voting is continuing at the county, in the county, for the August 6th election, and you should be sure and wear your mask. Correct, Rogers? Be sure and wear your mask.
That is an individual choice that the people do have when they come to vote. That is not a requirement to vote in this year's election because of voter suppression. So you can come and vote. You won't have any interference. No one's asking you questions, but we do encourage that.
Right. Early voting continues through August 1st, daily from 8 a.m. to 6 p.m. on weekdays. And this Saturday, I think, is the last Saturday, August 1st, and hours are 8 a.m. to 12 noon. Thanks to our friends at Think Tennessee, you can vote in Franklin at the Williams County Admin Complex or at the Franklin Recreation Complex, but recreation complexes across Williamson County and the John P. Holt Brentwood Library are also locations. A lot of people are choosing to vote absentee this year, but you need to have already, I think, been working on that process to make sure that happens for you. So early voting, usually no waiting, very easy to get in, get out. And these are federal and state primaries and then some local races. And school board in Williamson County and in the Franklin Special School District. So these are local elections. You can go to that williamsoncountytn.gov and learn more under the election registrar about how to early vote between now and August 1st or vote on election day. So this has been kind of a different day for us, but I think y'all are probably used to different